Hi guys, Dr. Mara Weinstein here. Today, I'm so excited to check out some viral hair loss videos with you and also some viral videos on acne and combination treatments so we can break down if they're fact or fiction. I'll break down what's actually backed by science and what we practice in the office and what's not. So let's get into it. So when it comes to hairstyling and hair loss, I always tell my patients that everything works in moderation, right? So if you're somebody who wears your hair up in these tight buns or tight braids all the time, then it could definitely lead to a little bit of traction alopecia, which can actually cause scarring on the scalp. So you want to be really careful how you style the hair. If you're always in a tight bun or you're always sleeping in a tight braid, there's definitely reason to alter your hairstyle so that you don't develop this type of alopecia called traction alopecia, which can be really hard to reverse. But just starting simple with altering your hairstyles can help prevent that. Prescribing hair growth routines is something I do all the time, every day in the office with my patients. And one thing that's super important is there are so many things out there that can help or that claim to help regrow hair, but it's really about maintaining a routine and addressing the scalp and addressing hair loss from all aspects. So first of all, topically, you definitely want to make sure that your scalp is healthy. So I do recommend an anti-age shampoo. Also internally, you want to make sure that all of your vitamins and nutrients are up to par. And so it's important to make sure your iron levels, your vitamin D levels, your zinc levels, a little bit of biotin can be okay. And those things all need to be replenished. And so I definitely recommend some vitamins for hair loss. And then other things like scalp massagers, red light therapy, and things like that can also be helpful. But really maintaining a routine of what your dermatologist prescribes is going to help regrow hair. Remember, hair grows in cycles. And so everything needs to be maintained for at least 3 months before you start switching things up. So there's so much out there. Don't get overwhelmed. Stick to the 1, 2, 3, 4 regimen that your dermatologist prescribes, and that's a great way to start to regrow your hair. There is no doubt about it. Hair loss is tough. It can be emotionally draining. It can cause psychosocial distress. It can prevent people from getting jobs and going out into the community and just even interacting with friends and family. So if you have experienced hair loss, do not wait to get help. It is so important to intervene early. There are so many things out there that can help regrow hair. And if over-the-counter things aren't helping, then it might be worthwhile seeing a board-certified dermatologist and getting worked up. There are things like blood work, family history, scalp health that we can assess to make sure that we're not missing anything. So don't wait. Hair loss can be so traumatic. We say you're supposed to lose about 150 hairs a day. So if you don't wash every day or you wash once a week, you're obviously going to see more hair shed than you normally would. But again, if you are losing hair and you've tried things over the counter and you've done your research, don't hesitate to go see a dermatologist or at least start with your primary care doctor to make sure that the hair that you're losing is actually a normal amount, or if it's too much, don't wait to get help, because there are ways to prevent increased hair shed and increased hair loss so that you don't get to a place where you feel like you have lost over 80% of your hair. So get help. Early intervention is key. Acne scars can be really tricky to get rid of, and there's not just one right modality. Here, this patient had fully ablative CO2 laser, which is one of the most aggressive procedures that can be done for acne scars. This does not have to be your journey. There are many other treatments that we can offer that involve less downtime. However, I always say that the more treatments you get, especially if they're fractional and not fully ablative, the better the scars will look. So fully ablative is sort of like a gung-ho, all-in, long downtime. You can see skin sloughing, high risk of infection, high risk of discomfort. Again, a lot of downtime. And so there are many other ways to treat acne. For example, a typical patient of mine would come in for a fractionally ablative treatment. Maybe we combine it with some Cision, some TCA cross, which was a chemical peeling technique to address those deeply pitted ice pick type scars. So again, there's different ways to treat acne scars, and there's also different types of acne scars. So not one treatment is going to fit all acne scarring patients. Just keep that in mind when you see things like this, because this is very dramatic, a very aggressive treatment, and not the only way to treat acne scars. So acne can be so disheartening. It can be so difficult to deal with. It can be very involved. This patient has nodulocystic acne. It looks like involving most of the face. And so the journey is long, and there are so many different treatments that are out there that can be effective for acne. And it might not just be one treatment that works for you. So Accutane is a wonderful treatment for nodular cystic acne, otherwise known as Isotretinoin, but it can really be a game changer. It works. And in this case, I would probably recommend a course of Isotretinoin and kind of watch the patient's acne melt away over time. And in this case, I would definitely recommend a course of Isotretinoin, possibly combined with some laser treatments for the redness and discoloration, and definitely some topical tretinoin post-oral treatment to help with skin remodeling and to reduce the onset of permanent scars. I'm a huge fan of microneedling. I love it. I do it in the office all the time. I think it definitely has a place to improve pore size, help with facial rejuvenation. It can definitely help with some pigment on the skin. It's not so effective for perioral dermatitis, but that's for another day. But I think the big red flag here is microneedling at home. So the device that she's using is an automated device, and each of those tips need to be changed between patients. So we have something similar in the office, but those tips should be sterilely packaged, sterilely cleaned, and actually disposed after every patient. So I highly recommend not microneedling your face at home unless you have a system where you can unpack sterile tips for single use, not to be shared between friends or family members. And the other point here is the glide agent for microneedling should be what comes in the packaging. So the hyaluronic acid is perfect. We also use PRP, which is platelet-rich plasma, but using something like a topical tretinoin that is not meant to be driven into the skin can cause some serious allergic reactions in certain patients. Now, in this patient, she said she's done it before and it's not had any issues, but there are reports of granulomatous reactions, which means nodules, bumps on the skin forming after patients are using microneedling with products that are not meant to be driven under that first layer of epidermis or that top layer of skin, like vitamin C, like tretinoin, like niacinamide, all these different things. Unless they're tested to be safe to use with a device, then they should not be used with microneedling. That's a red flag for me. I love the concept of combining treatments. We do it all the time in the office, and I think there's huge benefit to combining treatments. One of my favorite treatments to combine is the Clear and Brilliant laser with the BBL, which stands for broadband light. So essentially, if you have a bunch of brown and red spots on the skin and you also have textural and pore size issues, you can come in and in one treatment, takes about an hour total, you can have all of those concerns addressed. So there is definitely benefit to combining treatment. Again, I love doing BBL with a fractionally ablative laser. It delivers amazing results and gets your glow back. So some of these tips had promise, but others not so much. Remember, healthy hair starts with evidence-based treatments and early intervention. Healthy skin also involves using products that are right for your skin. And the take-home message with treating acne is don't wait to ask for help. Just like with everything, if it starts to get really bad and you're feeling low and depressed and socially withdrawn, get help from your board-certified dermatologist. There are amazing treatments out there now. You should not walk around feeling like that. And I'm not acne shaming. I'm just noting that there is help out there to get your skin looking healthier, because when you have acne, things going on internally that should be and can be adjusted so that your inner health is reflected on your outer skin. So if you enjoyed these reaction videos, hit like, subscribe, and comment on the next hair and skin trends that you want to review.